in addition to sleep, I wanted to delve into some nutrition related questions. And I think one that is really a hot topic for CoorsTek employees right now is what's the role of certain vitamins in immunity and perhaps preventing us from infection? And so what are your thoughts on, how to obtain the appropriate amount of vitamins in your diet and whether or not this is something that could stave off respiratory illnesses or infection?
So when we look at the supplementation, if your levels are normal, we don't recommend supplements. And that comes from that nurses study with hundreds of thousands of people who are not seeing a difference or an advantage with supplements in terms of mortality. So when there's a clinical need to add a supplement, yes. So if you've got macular degeneration, you're going to have a supplement. But by and large, it's better to get it from your food.
Okay.
When I'm reading about the vitamin D and the vitamin E, there are upper limits. And so we don't want to immunosuppress as a result of mega doses of micronutrients. Micronutrients mean we need very small amounts of them. And so when you look at a pandemic and everybody's thinking, oh my gosh, vitamin C, get my zinc, blah, 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 blah. The immune system is going to fight the virus. It's going to fight colds that you have. It doesn't prevent you from getting them. And so an immune system is from years and years and years of practicing behaviors. It doesn't all of a sudden show up because you're going to megadose a vitamin C supplement. And so I think it's really important for people, you do your best on the home front to cover your fruits and your vegetables.
Right.
And you do it consistently, and you exercise consistently because it makes your immune system stronger overall.
So, Kim, we've been hearing a lot about vitamin C, both in hospital-based studies with high doses of IV vitamin C, but then also just for public consumption. And so do you know much, are you familiar with the data around vitamin C supplementation? And are you a believer in vitamin C for prevention of viral illnesses, including COVID-19 possibly?
Our RDI, or recommended dose for vitamin C daily, is 60 milligrams, which is not a lot when you look at some of the supplements that are out there. It's not difficult to hit 60 milligrams. What we're looking at that is basically, we're going to prevent scurvy. And so when you look at 1,000 to 2,000 milligrams of vitamin C, it's considered a water-soluble vitamin. So there is a lot of excess that we will urinate out. The benefits of the vitamin C we're going to see in the immune system. We're going to see the antibody impact. So there's a little bump with regard to the antibodies. What I'm not real clear is if you're somebody who continually takes, say, 5,000 milligrams of vitamin C, and are you supposed to take more than that? Or if you reduce that, what kind of detriment do you see with regard to your immune system? That's the part that's fuzzy to me. And so, again, I watch for high doses of consistent intake of micronutrients.
Just to touch on the hospital-based data, we had seen in previous studies that patients who are highly physically active, I'm talking about Olympic athletes, active military members, when they take large doses of vitamin C, it can, in some cases, prevent viral illness, but this is really not applicable to the public at large. And so currently our recommendation is not for large amounts of increased supplementation to prevent illness. Inpatient side is interesting. There are some ICUs in America and worldwide that are trialing very high doses of IV vitamin C, but the data on that is too early to really interpret at this point. So it's being seen on a case-by-case basis. What are your thoughts on using probiotics? We've seen more and more data on how important the microbiome and the GI tract is. Are you recommending probiotics at this point for general use?
It's, again, interesting. You're talking about a supplement. And so I recommend people go down the dietary route. And so you look at fermented dairy products. And so you're consistent with it, that you have your yogurts or you have your kefir. Some people use buttermilk and sour creams. I mean, they all have these probiotics. And are probiotics important? Absolutely. But when you supplement them, it's different and you're changing your gut. Are you going to take it the rest of your life?